back to the Wellness Effect. Before we get going, please remember to hit the subscribe button so that you don't miss out on any of our future episodes. Dr. Bothma is back to continue our discussion around diabetes. Welcome, Doctor.
Thank you.
So, Dr. Bothma, why do pregnant women get diabetes?
When a woman falls pregnant, your body makes additional glucose available. And that is very important because we want this baby to grow.
Yes.
Okay. But if you are overweight, and remember in our previous discussion, we spoke about overweight with the link with insulin resistant. If you are overweight, if you are having your babies a little bit later in your life, if there's a strong familial history of diabetes, then it may happen that your body makes too much insulin available. And that is then what we call pregnancy diabetes, or the other term is gestational diabetes.
And what are the early indicators that I may develop diabetes when I'm pregnant?
So like I said, if a lady is already overweight before she even falls pregnant, if she developed gestational diabetes in her previous pregnancies, if she's expecting twins, then double the hormones, double the amount of glucose that's available. And like I said, also later in life, if you're having a baby older than 35, 36 years.
Sure. And post-pregnancy, does it go away, or do I not have to live with it?
So we do specific tests, and this is how we identify these patients. And then post-pregnancy, we repeat all the tests. So the good news is that most ladies that develop pregnancy diabetes resolve completely. 6 weeks postpartum after the birth, most of them are back to normal. But for us, it's a bit of a wake-up call, because if you have a tendency to develop pregnancy diabetic, 60% of those ladies are diabetics in about 10 or 15 years. So we say to our ladies, yes, your diabetes has resolved, but you need to stick to the diet. You need to lose your post-pregnancy weight. Otherwise, in the next pregnancy, it's going to happen again.
So it seems as though diet and weight gain are the two contributors, whether you're pregnant or not.
Absolutely.
With diabetes.
When ladies are pregnant, they often say, but shame, you're pregnant, you must eat. You're eating for two. Yes, but you're not eating for two adults. Okay. And actually, when we talk about pregnancy weight gain, you should gain the weight of the baby, about 3 or 4 kilograms, the weight of the placenta, and the weight of the additional blood. You should not be gaining more than 12 kilograms in a pregnancy. So being pregnant is not a blank check to eat whatever you want.
Wow. And then how do ladies who find themselves pregnant or are on the journey towards that, how can they almost create the right diet plan, the right exercise plan to ensure that they don't end up, getting pregnancy diabetes?
That's a good question. I think, again, we can look at the body mass index, that you should know what is a healthy weight for your specific height. Then we should all be doing more exercise, 150 minutes per week.
Even when you're pregnant?
Even when you are pregnant. Remember, pregnancy is not a disease. It's a physiological state, and your body is still strong. You're not going to run the comrades.
Absolutely.
But you can go for a walk.
Okay. Moderate exercises.
Yes.
Okay.
Yes. There are wonderful exercises that are safe in pregnancy. Pregnancy Pilates, pregnancy aerobics, and even brisk walking is very safe in pregnancy.
Very, very helpful, because I think a lot of the time individuals that are pregnant are just like, no, I'm not going to exercise, but you're advocating for more gentle exercises.
Absolutely, and your specific healthcare provider will give you some guidance. If you have a high-risk pregnancy, then you would be inclined to have to rest more. But that's what I say. It's a conversation between you and your gynecologist.
What sort of symptoms indicate that I might be getting, pregnancy diabetes?
So one of the first things that as doctors we will pick up is that every time if a pregnant lady goes for her sonars, they will pick up that this baby is actually growing a little bit more than what we were expecting. Because remember, if there's extra glucose available, this baby is going to grow proportionally to that sugar. So the gynae will say, these readings are a little bit higher, and then they will start thinking, maybe I should test this individual for gestational diabetes.
And how would a doctor confirm that the mother has pregnancy diabetes?
So it's called the oral glucose tolerance test. We give the patient a glass of water, which has a lot of glucose in. Then we take bloods when she's fasting, meaning before she eats anything. Then we give them this very big sugar load. And then after 1 hour and after 2 hours, we check their sugar levels. You should have a specific fasting level. And after getting this sugar load, your level should return to normal within 2 hours. And that's how we can pick up that this specific patient has a problem with metabolizing glucose.
And can this test be delivered at any hospital, doctor, clinic?
Yes, it's mostly done at a hospital because it's a little bit labor intensive, but it's done both in state and in public service. And most gynecologists will decide to screen their patients at around about 20 to 24 weeks.
And for partners who are walking the journey with their pregnant partners, what sort of support can they offer them as they go through this process of pregnancy?
I think that we should try and support a patient like this by not buying them chocolates. That's not the answer.
Those cravings.
Also, unhealthy cravings, if it's not a safe food product, like sushi, raw meat, which is a no-no in pregnancy. I think we must also educate our patients about what is healthy eating in terms of gestational diabetes.
So, Dr. Bothma, what are the risks involved for a pregnant mother who has pregnancy diabetes? What risks will she face during the pregnancy? What risks will having pregnancy diabetes cause for her unborn child?
So that's such an important question. If a baby gets additional glucose, they pick up weight very quickly. And that is what we call the macrosomic baby. These babies are much bigger than what they should be. So then you can imagine if you're sitting with a 5-kilogram baby instead of a 3-kilogram baby, there's no easy way to get that out. Okay, so a lot of these moms are going to land up needing a cesarean section instead of having a normal vaginal delivery. So that's the one problem, not an easy delivery. The second problem to the baby is that if this baby gets exposed to so much extra glucose, they sort of get pre-programmed and they can land up as diabetics themselves in a few years.
Wow.
So it's got huge implications for us. So we are treating the mother so that we don't land up with the next generation of diabetics. The risk to the mother also is having a cesarean section, which means a massive abdominal surgery, 3 days in the hospital, whereas a normal vaginal delivery would have been in and out. You go home the same day. As well as diabetics, because of the extra sugar content, they don't heal as fast as other patients. So now you've got a cesarean wound, and then the risk is always for poor wound healing. So it has massive implications for our healthcare system.
So it's a massive risk that society at large needs to consider.
Absolutely. And like we say also that if you had gestational diabetes, if you don't change your lifestyle, in a few years, you are going to be insulin resistant.
Thank you, Dr. Bothma, for such valuable information today. Thank you for watching. Remember to subscribe. Till next time. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.